Welcome to Lesson 5 of CPR First Aid with Abhishan. Today we're going to go over allergic reactions, heart attacks, the circulatory system, and anatomy. Allergic reactions. So what are some things people may be allergic to? People can be allergic to many things such as food items, which include eggs, nuts, chocolates, etc., insect stings or bites, for example, from bees. Many allergic reactions are mild, but they can turn to severe within just a few minutes. So what is an EpiPen? An EpiPen is epinephrine pen, which is just short for epinephrine pen, and it is used to treat severe allergic reactions called anaphylaxis. So using an EpiPen, it helps those with severe allergic reactions breathe easily. It contains small amounts of medicine that can be injected through clothing and takes several minutes to work, and is administered in the side of the thigh.
How to use.
So here are the steps to use an EpiPen. To get the EpiPen, take off the safety cap, follow the instructions on the pen, hold the EpiPen with your fist without touching either end because the needle comes out of one of the ends. Push the end with the needle hard against the side of the person's thigh, about halfway between the hip and the knee. Give the injection through clothes or even on bare skin. Hold the pen in place for 10 seconds. Remove the needle by pulling the pen straight out and rub the spot for 10 seconds as well. So using EpiPen, so taking off the safety cap and while the rescuer uses the EpiPen. Here's an image, and I also have a saying which helps you remember. It's called blue to the sky and orange to the thigh. So I know to put the orange is where the needle comes from. So now everyone just find one fact about EpiPens. So here are some facts. You can administer epinephrine through clothing. There are different doses for different people, so ages like young infants or adults. Early injection is important as well. Mild allergic reactions. Many allergic reactions are mild, but these are reactions that may seem mild that can become severe within a few minutes. So mild allergic reactions versus severe allergic reactions. What are some signs of mild allergic reactions? A stuffy nose, sneezing, itching around the eyes, itching of the skin, raised red rash on the skin, and it's called hives. What are the signs of severe allergic reactions? Trouble breathing, swelling of the tongue and the face, signs of shock. So how to treat severe allergic reactions? So first of all, you have to make sure the scene is safe. Send someone to get EMS. Tell the person, and if the person can respond, ask if they have a EpiPen and help them get it. Ask them if you can use it. If they can't use it themselves and you're allowed, use the EpiPen, give them an injection. Rub the injection spot, like I said, for 10 seconds. After using the EpiPen, dispose of it properly. Note the time of injection, and if the person needs CPR, give them CPR. Heart attacks. Heart attacks is the single biggest cause of death in the US. The first few minutes of a heart attack are very crucial. This is when the person is most likely to get worse and die. Many treatments of a heart attack will be successfully given. Signs of a heart attack. Chest discomfort. So many heart attacks involve the discomfort in the center of the chest that lasts for more than a few minutes that may go away and come back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. If someone has an uncomfortable feeling in the chest, think heart attack. Discomfort in the arms, jaw, back, neck, or abdomen. Symptoms can include pain or discomfort in one or both of arms, the back, neck, jaw, or abdomen. Shortness of breath, cold sweat, nausea, or lightheadedness. Less common signs of heart attack. So the signs in women, the elderly, and diabetics, they usually have less typical signs. They may have signs such as chest ache, heartburn, indigestion, discomfort in the same areas as before, shortness of breath, nausea, or vomiting. No, many people won't admit that their discomfort may be caused by a heart attack. If you suspect someone is having a heart attack, act quickly, don't hesitate, even if the person is uncomfortable admitting his discomfort. People often say, I'm too healthy, I don't want to bother the doctor, I don't want to frighten my wife. I'll feel silly if this isn't a heart attack. How to treat a heart attack. Make sure the person stays calm and rest. Have someone phone EMS. Ask someone to get the first aid kit and AED if it's available. If the person has no allergy to aspirin, no serious bleeding, or no signs of stroke, give them aspirin, either 2 low dose aspirin or 1 regular. If the person needs CPR, give them CPR. It's best if the person doesn't drive themselves to the hospital. Stay with them until someone with more advanced training arrives and takes over. Here's a chain of survival. So here's the steps we've been following throughout the course. First link is called the activation of emergency response system, so emergency services. So you must identify there's a problem and call EMS. Second step is using high quality CPR. So if a person needs CPR, give them CPR. Defibrillation includes the use of the AED, so to reset the rhythm of the heart. Advanced resuscitation is when people with more advanced training, advanced care comes over to take care. Post-cardiac arrest care is after the incident has occurred, the care after that. And recovery is any rehabilitation that may need to be given or advice for the patient. Circulatory system. The circulatory system, here's a video on it. You can watch it later. Now, find one fact about the circulatory system. What is the circulatory system? It's also known as the cardiovascular system. It is a transportation system of the body. It consists of the heart, blood vessels, and blood. It transports oxygen and nutrients to the body's cells, and it takes carbon dioxide and metabolic materials such as calcium, potassium, and iron away from the body cells. Parts of the circulatory system: the heart, cardiac cycle, conductive pathway, blood vessels, blood composition, plasma, blood cells, red and white. Now, everyone pick one of the following, teach everyone about it. So this is your homework. And diseases of the circulatory system include all of these. There's a lot. So some common ones are anemia, aneurysms, myocardial infarction, varicose veins, anatomy. So here are the planes. The sagittal plane is the medial plane. Its body parts closer to the midline, and body lines further from the midline, called lateral. Now we have the frontal plane, which is called the coronal plane. Body parts on the front are called ventral or anterior, and body parts on the back are called dorsal or posterior. Now the transverse plane. So superior body parts are above, inferior is below, cranial is closer to the head, while caudal is closer to the tail, your tailbone. Review. So signs of an allergic reaction include trouble breathing, swelling of the face and tongue, and the person may stop responding. True or false? True. Now that is the end of today's lesson. Now we'll meet again in lesson